to go with it.
Hey everybody,
Hi.
It's Lisa and Cristal with Science-Based Wellness.
Yeah.
Hope you're having a great Thursday.
Mm-hmm.
And, we were just sitting here having a discussion. I posted something on Facebook today about being on medications, and it gives us the idea that we are healthy. So
Mm-hmm.
you have an ailment, a symptom, you go to your doctor, he gives you a medication, you feel better, the symptom is not there any longer, so you basically, you feel like, okay, I'm fixed, I'm done.
But really, you're not.
But that
It's
is
just
so
covering it
not
up.
true. And we wanted to tell you that this is how, in one way, makes us so different. We need our meds for life-saving purposes.
Absolutely.
We need them, but they should only be temporary.
Mm-hmm.
Because what we like to do is try and get to the root of the problem and find out why you're having the symptoms. We need our doctors, we need our medications,
right.
but what we try and do is be a part of the team that helps you figure out. We do a little investigative work.
Yes.
To figure it
out. I mean, we sit here daily with our patients who come in with bagfuls of prescription medications that they take, and we have to sort them out with them and write them all down and get all these facts to Dr. Nichols. But the most important thing I can give you as a tip, as an elderly person or as a parent or someone who's seeing a medical physician to get prescriptions is these are 5 questions that you should always ask. Like, why am I getting this medication? Right?
Right.
Why are you giving it to me? What is your plan for me to get off of this medication?
Yeah, how long will I be on it?
How long will I be on it? What are the side effects of this medication?
Mm-hmm.
And even though I can guarantee you that 90% of them will say, oh, you might feel a little tired, you might feel a little nauseous, but it's probably no big deal. It's important because every one of those side effects that you feel, whether they're on a scale of 1 to 10 as being the worst and the best, even if it's a 1, it should be considered important.
You may not even
have
a side effect, and it's just down the road that it's going to be presenting problems. But,
so side effects really are nutrient depletions.
Right.
So, if they would say that on the pamphlet, these are the depletions that the medication is causing, we might all have a better realization that we should be replacing the depletions with some of the supplements.
Well, just like on TV when you watch the commercials for all the medications.
I love those commercials.
I know. We were talking about the one with the elephants and
romping
around.
on the ocean, and playing. And so you're totally distracted from the fact that there are some major things on the bottom of that TV screen that we're not paying attention to.
So
because it's such a great commercial.
Yeah, and all those things you feel
are
and
the last
the
one
medication.
is always death.
Yes,
right? Death.
Yes.
It could be death. So,
stroke.
Yeah, hello. That might catch our attention for a half a second, but maybe one person died and they say that and they have to say it. That's what I think. But those are things that we have to be really careful about.
And there are some very popular medications, not maybe popular because you want to be on them, but lots of things like statins and high blood pressure medicine. And we just we get some training on nutrient depletions and side effects.
We're trained.
Yeah, and so we were just looking at a few.
Here's a good one for a statin on Cristal. Everybody
Cristal.
Everybody is taking that one, I guess. But honestly, here is a list that is in big print for us because it's really, really tiny at the drugstore or the pharmacy. But I mean, some of these words I can't even say. Abdominal pain, nausea, chest pain, infection pain, pelvic pain, neck pain, hypertension, all these things that I can't say. Constipation, vomiting, flatulence, that's a good one. I know what that is. Gastritis, diabetes will be caused from this. Arthritis, some fracturing, some dizziness, insomnia, hypertension,
asthma,
depression, anxiety, vertigo. Okay, already I'm not even halfway through the list, and I don't want to take this drug. But here are what the nutrient depletions are from Crestor. And you can look it up in just as well as we can.
Yes.
We're not giving you any kind of like, funny business here. So depleted is vitamin A, vitamin D, vitamin E, vitamin K, calcium, folic acid, iron, magnesium, potassium, and CoQ10.
And our body needs all
one
of
drug.
these.
One drug does this to us.
Our body, these are things we need. And to get rid of a couple of symptoms, we're taking a medication that's going to cause possibly a lot more.
Yeah, so we just wanted to give you a little bit of information and be aware of what you're taking and why you're taking it, and find a plan to stop taking it, because we totally are with you. We want you all to be healthy, and if your cholesterol is like 500 or something, for crying out loud, you have to do something about it.
You do.
But you have to do other things besides take a pill. And then another thing, like when you're taking these drugs and medications, alcohol enhances them. And I know all kinds of people that take all these drugs and drink alcohol. So when you do that, you're even making the situation worse for your body. So please be aware and make sure you need this pill. And pills aren't always an easy fix, because it causes so many other things.
And we want to get to the root of the problem, and which we can try and help you with our testing. And
we can.
I mean, it's a team. It's a
team effort. We work always with other doctors and other clinics and things like that. But just to wrap it up, because I know we're like over our time limit on our video, we want you to all be healthy, and we want you to understand a little bit more.
And take control of your health and ask questions.
Always ask questions.
Yeah, you're paying for this service.
You are.
So you need to know.
Mm-hmm.
And any other questions, just Facebook us or call us or email us.
And ask your doctor, your whoever you're seeing all these questions.
Or pharmacists.
Pharmacists are so knowledgeable. They're the ones that get you out of all the trouble you're in. They'll tell you what the side effects are right to your face. And they know what interacts with other drugs. Because I know too many patients that come in here and are already on drugs that they shouldn't be interacting with, and their pharmacist has stopped them. So peace out to you, pharmacists. Thank you very much.
Be healthy. Till next time.
Yep.